Hi, good afternoon. My name is Dennis Gable, and I'm a vascular surgeon at the Baylor Scott and White Heart Hospital in Plano. I am the Chief of Vascular and Endovascular Surgery at that institution. And today we've got Jim Craig, who's probably one of the best known goalies in the history of hockey, with us to talk about aneurysm disease. Now, many of you may want to ask, well, why is a hockey goalie here talking about aneurysm disease? Which, when I first met Jim, I had the same question. Why are you worried about aneurysm disease? But I'm going to let him talk about that and talk about why he has a passion for discussing this and bringing this to the attention of everyone out there.
Well, Dr. Gable, first of all, it's a pleasure to be here. About 12 years ago, Medicare came out with the Ultimate Save campaign, and I was fortunate enough to be asked to be a spokesperson. And what they didn't know is that my father had died of a ruptured aneurysm. And so the more I learned about what abdominal aortic aneurysms were and how they were such a silent killer and how my father lost his life, I thought, boy, this is a great opportunity to bring awareness. And to me, awareness is the biggest factor here. As you know, most of the patients that come to you they're detected by accident. People don't know it. They went in, they had pneumonia, somebody gave them a screening or an x-ray and you found an aneurysm. But they don't know what hospital to go to. They really have no symptoms about this. What I found out is that my father had symptoms, and he had high blood pressure. He was a smoker. He had a massive heart attack at age 46. And so all these symptoms were there for him to go see a cardiovascular surgeon and to be checked for an aneurysm. He didn't. He had a rupture. He went to the wrong hospital. By the time he got to the correct place that could actually do the surgery, he had passed away of a rupture. So the reason why I'm so passionate is because it's preventable. And all of your great workers here in the hospital, all your surgeons, they create miracle work. They get things done. So if you get to see a patient in time and you get to put the proper devices in, that person goes home and their family is happy. But when you have a rupture, and as I'm sure you'll be able to discuss, it's a lot harder to do.
Right. And that can sometimes be a problem for sure. Many times patients that have abdominal aortic aneurysm have no idea they have it.
Right.
They don't have any symptoms. But as some of the folks in the audience may give us questions later, we're going to try to cover some of those things so that if other people that happen to see this are out there and they have some of these same medical issues, that may be a bell in their own head to go see their primary care doc or a vascular surgeon and say, hey, I've got these risk factors. Do I need to be screened for an aneurysm? When you talk about screening, what type of screening are you referring to, or what type of testing do you know of?
Yeah.
And I'm asking this from his standpoint, and then I'm going to cover that from a medical standpoint.
Well, what's amazing about this is, they call it the silent killer because it is asymptomatic, right? And so over the period of times, things that people should be aware of is if you're over 60 years old, if you've ever smoked, if you have a high blood pressure, if anybody in your family ever had a history of aneurysms or cardiovascular issues. But for me, it was as simple as getting an ultrasound. I called it putting some jelly on your belly. And there's no risk in an ultrasound. So what happened was, once I became aware, then I realized that I should get checked. That's the first thing I did. But not only that, for the folks out there, is my brother Don is 10 years older than I am. He was a smoker. He had all these symptoms. We went in to have him checked, and he had an aneurysm. And so by me becoming aware, I've already saved a person in my family's life, which you can do. And different generations, as you know, my dad, he was afraid of hospitals. They didn't have a lot of money. You only went to the hospital if you were really, really sick. And over the period of time, people have become more educated and realize that they have to be proactive. And so when you go to your primary care physician, and you're about 60 years old, have them check you for an aneurysm. Pay attention to what that is and be aware of people that you have as loved ones that could be at risk.
Most of the time, as a physician, looking at people that have potential to have aneurysmal disease, Several things pop out. One is, have you had a history of smoking in the past?
Right.
Doesn't matter whether it's cigarettes, cigars, doesn't matter whether it's half a pack a day, 5 packs a day. The fact that you smoke at all is going to increase your risk for having this disease.
Right.
High blood pressure, hypertension, that is another risk factor for aneurysm disease. Just the presence of atherosclerosis, which is very common in the United States and across the world, that also is a risk factor. Probably the strongest risk factor, as you mentioned, though, is a family history.
Right.
If you have a family history of someone having an aneurysm, whether or not they had a rupture or not,
Right.
maybe it was discovered and it was fixed. Just the fact that they have a history of having an aneurysm is the strongest predictor of other aneurysmal disease in a patient population. Now, when you go to test for that, you mentioned ultrasound. Did it hurt?
No, a little jelly on the belly.
And it does not take very long. An ultrasound has no radiation. It takes about 30 minutes or less to do that exam. And as you said, you put a little warm goo on your belly, and the ultrasound tech looks around,
Right.
and they can determine whether or not you have an aneurysm. And if you do, then maybe further testing may be required, or referral to a vascular specialist. If you don't, then you can be assured with good accuracy on the ultrasound that aneurysm does not exist there. A lot of times I'll get as a physician, I'll see a patient and we'll say, well, we need to do an ultrasound or a screening test or something of that nature, and they'll say, Doc, will insurance cover this? I can't afford this. One thing that did occur about 4 or 5 years ago is that Congress did pass the SAVE Act, SAAVE, SAVE Act, which states that anybody that turns to Medicare or comes on to Medicare, it's the Welcome to Medicare screening.
Right.
You get to Medicare age, you're given Medicare coverage. If you have any of these risk factors, your primary care doc or any physician can order the screening test, and Medicare will cover that test without question.
If you're deciding whether to get an ultrasound and you have these high risks because of the cost, then that's a bad decision. And most of the times, people within your community, whether it's your church or your local community people, will help you. Even as you go into the doctors and you ask to get the screen, it's really imperative that you pay attention to these things and realize that you don't get a second chance with a rupture. I mean, I don't think the patient, if they have an aneurysm and is found in the proper time frame, you have now these minimally invasive procedures, which you have you basically in and out in a day's time with really no risk. The success rate of these things are incredible. They're in the 99th percentile. But one thing I think the viewers should really be aware of is that there are community services around that have free screenings a lot of times. So it's an awareness. The second thing is, don't wait for your primary care physician to ask you. You be proactive and ask them. And correct me if I'm wrong, but even if a primary care physician does a physical examination, they miss it like 7 out of 10 times.
Correct.
And so it's really important that the viewers and the people here are aware that getting an ultrasound and having peace of mind, especially with the family history. You might not even know that somebody in your family had a ruptured aneurysm, but if they died in a way that's similar to this, it's probably worth getting checked.
And many times, you'll come across families that have had a history of aneurysm disease, and you talk to them and you find out, well, their uncle died, they don't know why, it was a sudden death, they blamed it on a heart attack.
Right.
Their aunt died, don't know why, they blame it on a heart attack. And many times that may be the case. But sometimes it may have been a ruptured aneurysm, and we just don't know that.
Yeah, and where I am with this now, if you're a 60-year-old male and you've ever smoked at all, if you have high blood pressure, if you have a family history of cardiovascular disease, it's your obligation, once you've seen this show, to go in and ask your primary care physician to recommend an ultrasound. And that way, you have peace of mind. Because, Dr. Gable, when a rupture happens, even if they make it out of the OR and they survive, their quality of life is completely different than it was before they went in. Wouldn't you agree?
Many times your quality of life is not going to be as staunch or solid as it may have been. And certainly, for sure, after a rupture, many times, even if you do recover fully, that recovery may take 6 or 12 months. When we're talking about an aneurysm, let's back up a minute. And when we talk about an aneurysm is a dilation of the artery. In other words, if you think of an inner tube, and we've all seen the bike tire, or we've heard about the bike tire that has a little bulge on it, little blub, and if you're riding it, that little blub is going to be what blows out on that tire. Right. It's the same idea in the vasculature. In other words, you may have a normal sized artery above and below it, but in a short segment, maybe 3 or 4 inches long, you'll have a dilation of the artery. And that dilation is the aneurysm. Now, by definition, when it gets to be 2.5 times normal, that's classified as an aneurysm. So a lot of people ask, well, how big is big enough? How big is big enough to fix? And just because you have an aneurysm, one of the questions I get as a vascular specialist is, well, it's small, but doc, can I go ahead and get it fixed now? Because I don't want to walk around with this time bomb.
Right.
We've looked at this over several decades, and it's been very well studied. Right. One of the things we know, and the current recommendation is for men, if you have an aneurysm that measures 5.5 centimeters, then that is when we recommend that these be treated and or repaired. If you're a woman,
yeah,
it may be a little smaller than that when we go to fix it. Right. There are other considerations as to the timing of when to fix. If someone, here in Texas, I have a lot of patients that come in from West Texas and they have no access to ready care that can do an aneurysm repair. And if they have a problem or a rupture and they present in a hospital out in, way out in a small town who does not do this procedure.
Right.
For me to get them, even if we fly them by helicopter to get them to our institution, may take 2 or 3 hours, and that may be 2 or 3 hours too long. You can be in the hospital, in the emergency room, and if you suffer a rupture, roughly 85% of people to 90% of people are not going to survive that.
It's not to scare people here, it's to make them aware. Emergency rooms, especially if you don't go to the right place, they're busy places. And so, you really need to know who your vascular surgeon is. You really need to know what hospital you're going to. And as you get older, this is something that you should write down just in case, so you know what goes on. It's almost like, before you're a young couple are going to have a baby, they get that bag packed. They know where to go. They have everything already. This is the type of awareness and preparation that we're trying to create throughout the country.
Just like the young couple that's getting ready to have their first or even their second child, most couples are going to look around. They're going to say, well, when I go to the hospital, I want to go to this hospital because I know the experience here. I've had friends that have gone there. They've talked about their doctors. And if you look at the hospital on the internet or on some of the ways that you can evaluate the outcomes of these hospitals, they have good outcomes at these hospitals for childbirth. It's very important that you do the same thing with aneurysm disease. Take the time, research your doctor, research your hospital. How many of these procedures do they do a year? How many procedures does a hospital do a year? What are the outcomes? What is the survival rate? What is the complication rate? Those are all questions that are reasonable questions for you to ask your doctor or the hospital, and find that out and research it before you choose to go see a specialist for your aneurysm disease.
Well, I can't emphasize enough, when my father died of a ruptured aneurysm, it started out where he had a symptom. He had back pain. He went to the local hospital. They said, you have kidney stones. They misdiagnosed him. By the time they figured out what was happening, his vital organs were shutting down. By the time he got to a hospital, when the surgeon had the chance to try to save him, it was much too late. And so this is about awareness. This is about being an advocate. It's not about the patient here. It's really about the loved ones and the people who are part of his, what I call inner circle, his family, that needs to become aware. And as I get older, my kids are going to be helping take care of me, and I'm not going to be as aware as I might want to have been. And so it's really important that we understand that this is a family, a community type thing. And if I was going to stress anything, is if you're 60 years old, you've ever smoked a cigarette, if you have high blood pressure, if anybody in your family has ever died of vascular disease, ask your primary care physician to get an ultrasound. If they say there's nothing wrong with you, boy, isn't that great news. If they find out there's something then the silent killer is going to get you, and then you can go and do your work.
And if you come and have a diagnosis of an aneurysm, suppose it's a small aneurysm like we talked about. Suppose it's only 3 or 4 centimeters. There are risks to fixing this with surgery, for sure. But also, we know the risks for rupture at a small size are very low. And so, currently, again, recommendations are set to fix it at a certain size because that's when the risk of rupture really increases. At a smaller size, 3 to 4 centimeters, current recommendations are to follow that with another ultrasound, either yearly or in some instances every other year, until it gets to be over 4 centimeters. And then at 4 to 4.5 centimeters, we may decrease that to every 6 months.
Right.
And then as it gets to be 5, then we'll start having conversations about fixing it.
Wouldn't that be perfect if we had all these people who don't even know they have any aneurysm out there, that we're doing it this way? And this is why we're doing this right now, is that so that people can be proactive.
And it's much easier to plan it if you know it's there than to show up, unfortunately, like your dad did, and have to plan it in a matter of seconds. And many times when people get diagnosed with aneurysm, they get fearful that, oh my God, I'm going to have surgery. Well, not necessarily. Not all aneurysms need to be fixed. If they stay small and remain small, we simply follow them, and you and I have a visit once every 6 or 12 months. If, on the other hand, they do get to a size to fix, there are 2 ways we fix it. Most commonly is, as you already described, is with an endovascular approach.
Right.
And that's done through 2 small 1-inch incisions in the groins. It takes a couple hours for the surgery typically. Most people will be ready to go home the next day.
Right.
And most people are back to doing what they want to do with no restrictions in about 4 to 6 weeks. Because of anatomical considerations, there are some people that still require an incision up and down their belly. Of course, nobody wants that. We all understand that. But there are some folks that will do better with that type of surgery. And we still do that in about 15% of folks. 85% of our patients are able to be fixed with an endograft.
You know, sometimes you'll go in and you'll have an aneurysm. Say you might be 85 years old, you might be 90 years old, and you go in and you've had your doctor forever, and he says, "Margaret, you're 90 years old. Don't take a risk on that." But these doctors, all these doctors today, they can go in, get out, and they can fix that. And so age should not stop you from being able to go in and get endovascular repair if it's proper.
And that's something that you can discuss with your physician. I mean, you go and get tested, you find out, do you have the aneurysm? And if you do, go talk to the specialist and find out what it would take to fix it. Oftentimes it's far less than what you think, and you can have a real conversation.
It really depends on who you're dealing with. So if you don't feel comfortable with the advice you're getting, there's plenty of other places you can get second opinions.
And you can have a real conversation. You can say, "Doc, I am 90 years old. Do I really need this?"
Right.
And you can both discuss the risks, and they can give you their opinion. But just because you go visit with them doesn't mean you have to have it done.
Right.
It's your decision as the patient in the end. But if you're going to make that decision, don't you want to make it with all the right information.
Yep.
And everything that's possible. So we've got a few questions that have come in.
What are the symptoms of an abdominal aortic aneurysm?
If you don't have a rupture, many times you have no symptoms.
Right.
You don't have pain. You don't have shortness of breath. You don't have chest pain. You don't have any problems with eating. It's just there. Now, the symptoms, if you are unfortunate and do have a rupture, some of the symptoms that people do have are just sudden onset of terrible back or belly pain. Many people in that instance, unfortunately, will pass out.
Yeah.
And if you have any of that, it may or may not be an aneurysm. There's multiple things that can cause that, but it's better to let your doctor at the closest emergency room figure that out for you.
If you have time.
If you have time.
Are there different types of abdominal aortic aneurysms?
There are some different types of aneurysms, and that gets into more of the medical side of it. Typically, or the most common aneurysm we see is what's called a fusiform aneurysm. And that's where you have a gentle dilation of the artery. It comes out to a certain size and then goes back down to normal. That is the most common. We also have a type of aneurysm called a saccular aneurysm, which is like the bleb on the bike tire. Those carry a little bit higher risk for rupture. And those, even though they may not be 5.5 centimeters, those, when we see those, we'll usually go and fix those regardless of the size based on the fact of increased risk. The fusiform aneurysms we may continue to follow for a while, and when they get to be size needing repair, we'll fix those.
What are the causes of abdominal aortic aneurysms?
We mentioned some of the causes from aneurysms already, but other causes could be you may have been in a bad wreck or a bad car wreck, or you've had a bad fall, and you can have a disruption of the artery, which leads to aneurysm degeneration. So those are also reasons that you can have this problem. And so a lot of times those are picked up, as you said, when you're going in for some unrelated imaging.
Right.
You're getting a CAT scan or you're getting an ultrasound for some other thing and they happen to see it. But that's the way it happens sometimes, and that's fortunate and fortuitous that they are able to find that. Because you don't, even though we have spoken about all the risk factors for aneurysms, you don't have to be a smoker.
Right.
You don't have to have high blood pressure.
Right.
You don't have to have a family history of aneurysm disease, and you can still be someone who has an aneurysm, although the risk is not quite as high.
Yeah, and I can speak to that because I was doing a community event with Gore in Petoskey, Michigan, and this guy came in perfect shape. He's about 50, 60 years old, and he came in for an autograph. And I said, well, if you're here, you're going to get screened. He goes, no, I don't need to get screened. So, well, I'm not going to give you the autograph if you don't get screened. So he went in, got screened. He had an aneurysm. And he had 8 brothers. And so he went and had his brothers tested, and 3 of them had an aneurysm. And so if I looked at him, I would have said, no, you don't need to get tested. And so to your point, it's just a good thing to do.
Right. Yeah, that's amazing. That's another 4 or 5 lives, perhaps.
Yes.
What should I do if I have risk factors for an abdominal aortic aneurysm?
As far as where to go, how to go, I really think it starts in the community, in my opinion, with your primary care physician, where you become more proactive and make sure that when you're of age, or if you have any of these type profiles that we talked about, that you make sure that you're the one that's asking the questions and not assuming that somebody's going to be asking the questions for you.
You need to take responsibility. You as a patient need to take responsibility for your own health. I, as a specialist, your primary care, we're all trying to look out for the best outcome for you. But if your physician has not brought this to your attention, then you need to bring it to their attention and say, hey, doc, my brother Bob had an aneurysm and I've never been checked. He may not know that Bob had an aneurysm. So it's important for you to be active in your own medical care.
Our job here today is to make everyone who's watching it become an advocate on making people that they love aware of this, and in some cases, be the one that goes and brings them and gets the things done. And so awareness is what's going to prevent this people from dying. And I know when my father died, he never got to see my son's wedding. He never saw my granddaughter. There's so many different generations that are affected by this. So it's important as you develop your family tree and you start to look at all these things, be aware, be proactive and take action. In 1980, when our team was fortunate enough to represent our country and win a gold medal, I did my job. And now, as I've got older and I have a chance to do a different chapter of my life to help bring awareness and save people's lives, it's really important to me. I saw my father pass, I saw how hard it was, and I saw how preventable it was. So today, this type of save is so much easier because I have help, and that's for everybody who's out there watching it, who now has a responsibility to go out and pay attention to what they've learned today and to care about all the people that they love and to help save lives.
I'd like to take a minute and really thank Jim for taking his time out and coming to visit with us here in Plano.
This has been a lot of fun.
Yeah, very good. Thanks
Thank
for
you,
coming.
man. Yeah, it was great.
Good to see you.